Welcome to the Headache Doctor Podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication, allowing you to thrive in everything you do. Hello and welcome to the Headache Doctor Podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. On today's podcast, we're going to talk all about thresholds, medication, and how you should pursue help. This podcast, I think, is going to be very helpful for a lot of people, just framing your context of how you should view your own situation and the type of treatment you need. One of the things that we run into here at Novera are patients or just people that we interact with that fall victim to this mentality of the next thing being the thing that is their problem. So the assumption is that there's one thing that if we just unlock or unhitch this one problem that's causing these symptoms, then you will be fine. And that's just not the way the body works. Now, there are certain factors that play into different types of headaches and migraines that can play a large part, and we feel like we're doing that for most of our patients. We're that big major component that they've missed so far. But the purpose of this podcast is to talk about all of the little things that combine to make this experience of headaches or migraines so debilitating. We're going to talk about the threshold theory, which is around there it's around the internet. If you search for maybe the underlying cause of headaches or migraines or understanding migraine symptoms, this threshold theory of migraine will pop up. And so we're going to talk about that because it's going to be helpful understanding thresholds, understanding how medication plays into this, and then finally how you should take all of that info and what you should pursue as far as helping yourself when it comes to your mentality and how you perceive this problem. And it's going to be less of a one thing, or here is the thing, and more of a let's look at health in general and what are multiple things that I can do to improve my situation. So not only the pain itself is being addressed, but also the environment that the pain's experienced in, meaning your overall health and wellness. All right, so first, let's look at threshold. So everyone has a different threshold. It's just this internal boundary that if it's crossed or if you push it over that limit, you'll have a migraine attack. All right, so everyone with migraines will have a different threshold. And you're dealing with that threshold. That's why we see this fluctuation. The pain will ramp up and you might have a migraine like once a week or once a month or multiple times a week, whatever your frequency is. When the migraine attack presents itself, it'll last for however long, whether that's hours or multiple days. And then most of the time people are having some respite, some reprieve from the actual pain, whatever symptoms come with their migraine. And so that cycle that we're seeing, you're seeing your threshold either drop or the intensity of the pain rise to a level where it pushes past that internal boundary. So what's impacting that boundary? So oftentimes I'll refer to threshold and then the actual line of tension. So if you picture a graph with two lines, horizontal lines that go across, the actual threshold line can fluctuate and the actual tension line can fluctuate. So if your threshold drops, what's impacting that? And I've come up with a few different categories of factors that will impact someone's threshold. So the first would be environmental factors. If you are someone that deals with barometric pressure changes being a trigger, that would be an environmental factor. Now, there's a couple things that are going on that's happening with barometric pressure changes, but oftentimes it's a direct impact on the joint or inflammation within the joint that can't respond to the barometric pressure changing, and so the joint becomes more irritated. The other environmental factor might be lights, sounds, smells, so the harsh sensations, the bright lights, the harsh sounds, the strong scents. Those can be triggers for people. Those are more environmental factors. So those are somewhat out of your control, right? And then we have physiological factors. So this might be something like Inflammation, systemic inflammation. We've had patients with mast cell activation, other autoimmune responses that just cater to a higher level of inflammation within the body is going to correlate with a lower threshold. Stress. If you have high levels of stress, that's going to have a negative physiological impact, and it's going to lower your threshold. And then the other factor is hormones. So hormones, estrogen levels in particular, are going to fluctuate in women, and those fluctuations can impact your body's threshold for tolerating pain. All right, so physical factors, the actual physical factors that impact threshold are going to be posture. So this is going to be both the inherited posture from your mom and dad, and naturally how their anatomy is structured. So you might be more prone to forward shoulder or forward head position. Different people will naturally sort of inherit a certain type of posture, but then there's also the learned posture, more behavioral type posture. That's an adaptation or a response to stress, lack of movement, or a certain type of movement over a long period of time. And so we see these different stresses and these different postures pop up that can be a factor in how much tension you have in your neck and the actual source of pain itself. And then we have the amount of movement that you have throughout your day, throughout your week, throughout your year, over the past several years. What does movement look like? Has there been a reduction or an absence of movement, or have we had the appropriate amount? Have we had too much? Meaning, are you pushing your body at an intensity level with a certain type of exercise that maybe is not, your body itself is not equipped enough to handle that? So it's the stress itself, even though it might seemingly be good to exercise, the intensity or the type of exercise might actually be contributing to your headaches and migraines. So there's a little bit of nuance there, but the principle with that is we want people to move, and so generally the sedentary positions are going to increase the level of tension, which again is going to play into this migraine cycle and your threshold. And then we have dietary factors, so we have things like inflammatory foods, whether that's MSG or nitrates or nitrites, aged cheese, chocolate, nuts. Alcohol is a big one for a lot of patients, citrus fruits. So there are certain foods that have an inflammatory effect, and if you are someone that has found that when you consume this type of food, you tend to get a migraine, that's likely what's happening. Your GI system is having a response that increases the level of inflammation and lowers your threshold. So again, just to recap, we've got environmental factors like barometric pressure, light, sound, smells. We've got physiological factors. We've got your overall health. We've got stress levels. We've got inflammatory problems. We've got hormones that are changing. We've got physical factors. We've got posture, the amount of movement you're giving your body throughout the day. And then we've also got dietary factors. So the inflammatory foods, or really just a well-balanced diet. Like, what does your diet look like? So in general terms, but also with specific foods that you might be consuming. And we could even go down, like I've had conversations even just recently with Jeff Hunter on the functional medicine side of things and how we look at our GI system and gut health and how that impacts someone that experiences headaches or migraines. And so all these things are going to play into your specific threshold. Now, the reason that this is unique to you, because all of these things look very different for every person. Now, some of the constants might be, if you live in Colorado Springs, we're all going to experience the same level of change in the barometric pressure. All right, so generally after a storm, if we get snow or rain, the number of people that come in, whether that's active patients or just new patients, we tend to get more phone calls because people are like, the pressure change is a big trigger for me. The other things that, pretty much most of outside of that is going to be unique to you. Okay, so we've got the physical factors are going to be unique to you. The physiological factors are going to be unique to you. And those dietary factors are unique to you. Okay? So why is that important to understand? And then how do we approach this? So the Western medicine model has stopped at sort of this idea of let's look at triggers, let's avoid triggers. And I've had people that have traveled out to places like Johns Hopkins, and so these elite level institutions that have a lot of funding and the smartest neurologists out there. And I've heard that they just have a more in-depth process of avoiding triggers and maybe a more focused process when prescribing medication. But those two things kind of define our Western medicine model. You are avoiding triggers and you're taking medication. Now, I would argue that avoiding triggers is not sufficient. Taking medication is not sufficient. Most people that we interact with, now our sample size, these are people that are seeking out treatment, but I think it's safe to say that medication for most people, it's not cutting it. The people that we are having in our clinic, most of them have trialed medication. Usually it's short term, so you take it for however long. Usually it's a matter of months. Maybe the side effects kick in. Maybe your body just adapts to that medication so it loses its impact or its efficacy. And so you stop taking it. But then you're left taking some other medication, and it just feels like this endless cycle of you're avoiding your triggers. Maybe you're just trying to figure out your triggers and you have no idea what's happening. If I listed off all those different factors, maybe some of you can relate to specifics. Others, you're like, I have no idea. This is totally random. And what's happening there is you probably have such a high level of tension, and the actual pain itself is at a high level. So any little thing, any one of those little factors is going to impact it. But it's not as if one factor is impacting you at one single time. All of those things are playing into your situation in real time. And so for us to look at, that's why we say it's not one thing. It's not like the thing that is providing you with this migraine. And if we remove that, then you're totally good. We have to look at overall health. So we have to ask the question, why? So let's talk about the actual source of pain. So not everyone with systemic inflammation or maybe intolerances to certain foods, or sensitivities to these different factors that impact threshold. Not everyone with a low threshold is going to, one, have migraines. It's not as if you have systemic inflammation, you might have headaches or you might have migraines in a certain presentation, but that doesn't mean someone else with that same problem also has the same presentation of headache or migraine, or maybe they don't even have headaches. They have different sort of problems going on. And so it's not as if like inflammation itself is the problem. It's not as if the certain foods are the problem. And it's not as if like just the stress or the environmental things of barometric pressure are the problem. Because take, for example, in Colorado Springs, if the pressure changes, some people have headaches and some people don't. So why do some people have headaches and some people don't? Well, we have to ask the question, why? Why is that pain there? Why is that specific pain presentation showing up? In most of our patients, it is a very specific presentation. They can say it's either right-sided or left-sided. Maybe it's both sides, but then it's located in the temple. Maybe it's in the front of the head, in the back of the head. Maybe it changes, okay? So why are you getting that specific pain presentation? And to answer that question, it takes us to the different sorts of tissues that can actually cause pain. So the pain signal itself needs to come from somewhere, and then the environment that your brain experiences the pain in would be known as your threshold, is what the threshold is impacting. And if that threshold's low, then you're going to be very quick to experience pain. And if your threshold's high, you're going to be able to tolerate a higher level of pain or tension. But the common factor when people have headaches is the pain is coming from somewhere. And that's why here at Novera Headache Center, we have seen every type of headache and migraine and seen those types of headaches and migraines and every different type improve with our process and be able to trace it back to some sort of neck or jaw or shoulder problem. Okay, so something has to actually be causing the pain signal itself, okay? So that is a constant. We can't assume that avoiding triggers is getting to the bottom of it, because it's not. you have to actually have something that's generating pain. All right? So what could generate pain? I came up with a list that's not totally comprehensive, but it covers the major things that can send pain into our head or cause us to have head or facial pain. So first we have the neck. I've talked a lot about the neck. If I say the neck can cause head or facial pain and you're like, I don't know what you mean by that, I want you to search for a podcast called The Most Overlooked Cause of Headaches and Migraines, because in that podcast, I will go into detail on why the neck can be a source of pain for headaches and migraines. And really it's threaded throughout a lot of our podcasts, but that one hits it at its core. All right, and then we have the jaw. So just a patient earlier today has pain in her temples, and she clenches and grinds her teeth. So when she wakes up and she has pain in her temples, that would be the temporalis muscle. That's secondary to the jaw being dysfunctional. The jaw itself can refer pain into the head as well. We have shoulder tension, so oftentimes I'll be working on someone's shoulders, whether that's through dry needling or some other pressure, and that will actually send pain into their head, causing or replicating their headache. So we know that shoulder tension can refer pain into the head and cause head pain. Okay, so those are the three big ones that we primarily focus on because that's kind of the low-hanging fruit. If you have head or facial pain, if you hear hooves, think horse, not zebra. Okay, it's very unlikely that you're going to see a zebra if you hear something with hooves that is trotting towards you. All right. So that's a saying that's very common in medicine, and when you have a certain set of symptoms, it goes with a certain diagnosis. When we have a certain set of symptoms, pain presentations, we can assume most of the time we can trace it back to referral pattern in the jaw or the neck or the shoulders. Now, there's a lot of other things that can go into a pain presentation. I don't want to get into those on this podcast, and we've talked about those in the past, but for the sake of this discussion, let's just assume those three things are at the top of the list for referring pain into the head. Also on that list, we have things like potentially your dura is inflamed. So these are the things like if your head hurts, you kind of naturally think like my brain might have a problem, or what's inside my head that's hurting. So inflammation of the dura is this sheath that goes around our central nervous system. So our brain is kind of covered with this thick tissue. There's different layers to it, but it's called the dura. And the dura has blood vessels that run through it. The dura can be sensitized to things like pressure, increased pressure, inflammation, and can cause pain. And so the dura itself can be a source of headaches. Usually that's kind of a diffuse headache. It's not a very descriptive headache. Almost nearly all the patients that we work with, I'm never typically thinking like, oh, your dura may be inflamed, because they have a specific pattern. It's either the back of the neck, it's in the temples, it wraps up and around. And it's not this just sort of undescriptive general pain that's there all the time and doesn't respond to any sort of movements or those environmental factors or all these things, okay? And so the increased pressure as well in the dura. So those are things like internally in the brain. But again, if we hear hooves, we shouldn't think that you have this problem. We shouldn't assume you have that problem right away. Our Western medicine model is actually really good at screening for the things that are likely going to be life-threatening. And so if you're worried about something being life-threatening, then yeah, you should definitely go see the emergency room or someone with an MD behind their name, because that's what they're good at. They're good at keeping you alive and doing those procedures that are life-saving. But 90+% of people that are experiencing, especially chronic headaches and migraines, if you've gone through those tests, you don't know what's causing it. Yeah, let's assume your neck, your jaw, your shoulder tension, and you're getting that referral pattern. So the pain's coming from somewhere. So let's talk about medication. So not only are you avoiding triggers, but you're adding medication. And what is the medication doing? Well, at a high-level summary, there's a few different categories. And again, this list isn't comprehensive, but it hits the big ones. So we're either shutting off the pain pathway with these new CGRP drugs, which are pretty common, prevalent, like Nurtec, Aimovig, Ajovy, or we're manipulating serotonin levels or mimicking serotonin or doing something with serotonin, which is more like the triptan category, like the MAC salts and things like that. We can also paralyze the muscle. If you just want to shoot some Botox into that area, that can be effective for a lot of people, but it's actually really curious because Botox is interacting with muscle tissue and tense muscle tissue, and when it works, it's telling us that that muscle is not happy, which is exactly what we're doing, but we're actually doing it in a way that's natural and getting at the why behind that muscle being angry. So if Botox works for you, I would definitely question that and say, well, if Botox is working, then taking an approach of working with a physical therapist, restoring function to my neck, should also be very effective. Botox is a toxin, it's a chemical, it artificially shuts off the muscle. So it's just troubleshooting it. It's like, it's just like, oh, your muscle hurts. Well, let's just put it out of commission. Let's just shut it off. Tell it to stop doing its job. And there's other problems that can arise with that sort of process, because we're not actually getting at the problem. We're just we're shutting it off through chemicals, and then 3 months later we got to do it again. Reduces inflammation. So this other category is just NSAIDs or steroids. Like, we're finding a way to reduce the level of inflammation. Inflammation is a way for a body to receive a pain signal. So the inflammatory process is kind of what starts the pain signal actually being sent to our brain. And so if we just take the inflammation out, we don't experience the pain. But again, we have to ask the question, like, why was the inflammation there in the first place? And if we just take NSAIDs or steroids or inject something into that area, it's not getting at the why. Why was this happening in the first place? Okay? So if avoiding triggers isn't necessarily the answer, if taking medications isn't necessarily the answer, does this mean that we stop avoiding triggers? Does it mean that we stop taking the medication? So what I'm going to do is I'm going to say, okay, our current model is telling you to avoid your triggers and take the medication. All right. So one of the things that it's missing is this idea of overall health. All right. So when we talked about those different factors that impact your threshold, improving your overall health is going to improve your threshold. That's just the way our body works. So think about how you are, the level of movement and exercise you have to what you're consuming and eating. What does your diet look like? All right. So we want to address those things. We don't just want to avoid certain foods. We want to look at overall health in general. But the point of this specific podcast is to say that if you try to avoid a certain trigger, or if you try to take that specific medication, or if you try that specific supplement, or maybe you eliminate that certain food, and if that doesn't work, or even if it does work, that it is a piece of the picture. And so what we want to do is have a more comprehensive approach. And as you are pursuing treatment and you're pursuing what is going to help me in my situation, I'd want to encourage you to look at your overall health, like we just talked about. But two, as you're pursuing different providers or specialists that are helping you pursue overall health, don't work with a provider and base the value of whatever it may be. So maybe you're working with a functional medicine doctor and you're improving your gut health. And you go through that process and maybe you feel better, you have more energy, and you know that these are good for you, but maybe the migraine itself, those symptoms haven't changed too much. Well, that's okay. That doesn't mean you need to abandon those principles that you've put in place, because those overall health benefits over time will improve your threshold. And so you need to take that and then you need to layer something else on and say, okay, this component of my health and this component of my body physiologically and what I know is good for me, we can kind of like check that box and then continue that, right? And then we want to figure out, well, what's another layer here? And what we're doing is maybe pursuing just an overall healthy picture of what your lifestyle looks like, what your diet looks like. If we're addressing the actual problem of pain itself, which is where we come in, along with coaching you through the process of like, how do we understand what else might be affecting this, impacting your threshold, okay? So this is me responding through a podcast to someone who says, I tried this, but it didn't work, or I tried that and it didn't work. And oftentimes there's a long list of what seemingly are good things that someone's tried before they come to see us. And they're sort of just like checking off those boxes, but saying like that didn't work. And sometimes we have to carry over principles or practices or the good things from these different providers or types of treatments and use all of that information to provide us with an improved threshold and a reduction in the actual source of pain itself. So that means that medication may be on board for a period of time, but we want to be pursuing those deeper levels. It may mean that we are avoiding triggers, but we want to get to the deeper level of like maybe if you have some sort of food trigger, maybe we need to look further into your gut health. If you have some sort of barometric pressure response, maybe we need to figure out why your joint is so agitated or irritated to that change in pressure. So the why behind it is going to be a better question to ask than just saying, well, I'm looking for that specific trigger to avoid so that I can sort of I don't have to worry about these migraines again. The body's made up of multiple systems that all work together, and so we need to understand all those different systems, how they coordinate with each other, so that you can understand your health better and know who to pursue as far as treatment. That's the point of this podcast, and that's what we're on a mission to do here at Novera Headache Center and on the Headache Doctor podcast. If you listen to this podcast, you appreciate what you're doing, I want you to write us a review. I want you to share this information with someone you know that has headaches and migraines. We're on a mission, as we always talk about, to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication, allowing you to thrive in everything you do. And that really is, that's a pursuit I'm going to be on for a long, long time. And I hope that we can move the needle from medication avoiding triggers to thinking about overall health. And I hope that this podcast gets us out of the one-track mindset and looking at big picture. How can you improve your health? How can we get to the why behind improving your threshold and why your threshold might be low, but also understanding the what of what is causing your pain, what's the actual pain signal coming from. Thank you so much for listening to the Headache Doctor podcast. Stay tuned next week for another episode allowing you to educating you and allowing you to feel empowered with your own situation on this journey to find relief. Thanks for listening.